Here's the thing. I've been a chiropractor for, well, over 30 years now. And if there's one thing I've learned, it's that pillow selection is not just about comfort or personal preference. It's science, especially when we're talking about neck health. In my clinic, we've seen time and time again that the key to good sleep and a healthy spine is something called cervical neutral alignment. Basically, your chin shouldn't tilt up or down more than about 10 degrees from your sternum when you're lying down. Most people don't realize it, but the average pillow they're using is either 2 inches too high or too low. That doesn't sound like much, but it's the same as sleeping with your head tilted at a 30-degree angle all night. So imagine holding a 25-pound weight off your neck while you sleep. Yeah, not great. And at our clinic, we've actually tested hundreds of pillows using 3D motion capture and pressure mapping. And here's what we found. Latex foam consistently outperforms memory foam and feathers. In fact, in clinical pressure mapping tests, it delivered 38% better pressure redistribution, according to the Journal of Spinal Research, 2021. And that matters because latex has this natural resilience. It contours without sinking. If your head sinks more than 1.5 inches, your cervical vertebrae start to drift out of alignment. And we saw that happening in the majority of side sleepers using standard pillows. That's why I designed the pillows we use at the Spinery, based on actual patient outcomes and biomechanical data, not marketing claims. Now, I always tell patients there's an adjustment period. In our trials, most folks reported a noticeable improvement in stiffness within 3 to 7 days. But full muscle adaptation can take a couple of weeks, 2 to 3 usually. That said, if you're still feeling increased pain after 10 days, the pillow is probably not the right fit for your sleep position. Back sleepers generally need about 3 to 5 inches of lift. Side sleepers need more, around 5 to 7 inches, and your body width plays a role too. A really easy test: lie down, rest your head, and have someone check if your nose lines up vertically with your sternum. If it doesn't, your neck's probably straining. Now, 3 big red flags from our research. First, memory foam traps heat, and we saw that it increases tossing and turning by about 40%. This was backed up in Sleep Medicine Reviews, 2022. Second, feather pillows, they lose around 60% of their support within just 6 months. And third, and this one surprises people, your ideal pillow height actually changes with age because spinal discs compress. So we recommend reassessing your pillow every 3 years or so. Look, the right pillow isn't going to cure every spinal issue, but in our practice, when patients used a properly fitted latex pillow along with chiropractic care, we saw a 52% average reduction in cervical strain on VAS pain scales. That's a big deal. So yeah, when it comes to sleep, don't overlook your pillow. It's not just about comfort, it's about keeping your neck in alignment, reducing strain, and giving your body the chance to recover night after night.